Good evening, everyone, and good morning to our speaker. On this occasion of World No Tobacco Day 2026, welcome to today's webinar on tobacco control, a model for success for global health in the 21st century. We have a speaker, Professor Les Hagen, who's the Executive Director, Action on Smoking and Health from ASH Canada. Along with him is our moderator for today, Dr. Rakesh Gupta, who's a member of the union and the president and director of Strategic Institute for Public Health, Education and Research. Welcome, everyone. Welcome to all our participants who have taken out the time to join us for this evening webinar. A very warm welcome to Dr. Narendra, who's from Rajasthan, Dr. Avdesh Kumar, Professor Sonu Goyal, Dr. Jyoti Tiwari, Dr. Denny Matthew, Dr. Indu Sonwani. Welcome to this webinar. So my name is Dr. Paridhi Modi. I'm a manager at Eco India, and I'll be your host today. So I think we'll just switch on our cameras for a minute. If we can just take a group photograph with everyone to commemorate this webinar. I'll just stop sharing so I can see everyone. Requesting everyone to please quickly switch on their cameras. We all have beautiful faces and beautiful smiles. All right. So on the count of three, bright, beautiful smiles. 1, 2, 3. I will just take one more. Few more people have switched on their cameras. So 1, 2, 3. Thank you.
We also have Dr. Shoko with us. He is a regular attendee of all the webinars of Sipher.
Welcome, sir. Yeah. So moving on, I would like to welcome our moderator, Dr. Rakesh Gupta, Chairperson, Tobacco Control Section member under the union, and the President and Director of Sipher, to please welcome Les Hagen and also give the welcome address. So over to you.
Yeah. So first of all, I must say that we are celebrating or observing World No Tobacco Day in 2026. And the theme for the WHO World No Tobacco Day is Unmasking the Appeal, Countering Nicotine and Tobacco Addiction. The annual campaign targets misleading marketing tactics that hook young people. And the key priorities for the 2026 initiative include the exposing the tactics of the tobacco industry, and regarding use of synthetic nicotine, nicotine salts, and flavored products marked as innovative. Next, please. So we need to have a policy action pushing the strict bans on flavored products, plain packaging, and digital and social marketing advertisement should be curbed. And we must have empowerment, equipping the youth with the knowledge to resist peer pressure and deceptive industry manipulation. The goal and the call is dismantling the cycle of addiction and ensuring stronger protective regulations for future generations. Thank you. Next, please. So we have Professor Les Hagen with us. He's MSM and Executive Director, Action on Smoking and Health, ASH Canada. He's also an adjunct professor, School of Public Health, University of Alberta, Tobacco Control Section member in the International Union Against Tuberculosis and Lung Disease. So you're welcome, sir. And he has can you just the slide before this slide? So he has published an editorial regarding tobacco control, a model success for global health in the 21st century. He is the main author of this editorial, and we'll have a presentation from him. Yeah, you're welcome, sir.
Wonderful. Thank you, Dr. Gupta. It's a real pleasure to be with all of you. I know it's late in India, so I really appreciate those who are joining us live. And I certainly don't begrudge anyone who is recording. It's 9 a.m. in Western Canada right now, so it's a more reasonable time. Um, and I want to thank everyone for joining us. I want to thank the organizers of this event, uh, including including Sipher, Project Echo, the Union, of course, and the Union International Union Against Tuberculosis and Lung Disease, and the Indian Medical Association. Next slide. No conflicts to declare. ASH is one of Canada's leading tobacco control organizations, and we don't accept any funds from tobacco or nicotine companies, and we certainly don't encourage anyone to do so. Next slide. So just a quick overview on the union and its work in tobacco control, which is substantial. Its priorities include capacity building, policy making, and implementation. It's been working in the field for many, many years, certainly as long as I've been involved with this issue, which has been several decades. And the union strongly supports the advancement and acceleration of the Framework Convention, the Global Public Health Treaty on Tobacco Control. And we've seen that expressed in many ways, and including this event, which is in recognition of World No Tobacco Day 2026. And the union helps to facilitate global knowledge translation and sharing across many countries and stakeholders. And quite notably, the union hosted the World Conference on Tobacco Control in Dublin in 2025. And I know a number of you were there. It was great to engage. It had been many years, I think 7 years since our last World Conference, due to all the complications resulting from the COVID-19 pandemic. Over 1,300 delegates participated and joined together in a global call to action known as the Dublin Declaration, which, among other things, calls for the acceleration of the implementation of the Tobacco Control Treaty. Next slide. So I'm a member of the Tobacco Control section, and Dr. Gupta chairs the scientific committee. And this section is comprised of world-leading lung health experts and tobacco control champions who all share a passion for tobacco control and for creating a tobacco-free world. And I feel that passion whenever we get together. We're all working and contributing to this effort, and with the guidance of the union. All of the participation and contributions that we make on behalf of the union are completely voluntary. So that, we have this. The people who are involved are very committed, and the process is collaborative, it's collegial, and it's very productive. And I've certainly enjoyed my time with the union to date. Next slide. So. This presentation profiles a recent editorial on the impact of tobacco control on global health, published in the March edition of the journal Tobacco Control, which is the preeminent tobacco control journal. And I would certainly like to thank all of the co-authors, which include my colleagues on the scientific committee for the union tobacco control section. Including Dr. Gupta, as well as the chief editor for Tobacco Control, Marita Heffler. And today's presentation is intended to mark World No Tobacco Day, as we've mentioned already. This editorial stemmed from discussions initiated at COP11 for the Framework Convention that was held last year in Geneva, last fall. And it provides an overview of significant developments over the past 25 years. And in speaking in advance to the editor of Tobacco Control, I had asked if anyone had recently prepared an overview, an editorial, or a commentary on the impact of tobacco control over the past 25 years. And I was kind of surprised to learn that the answer was no. And I was then challenged to prepare that editorial. So here it is. Next slide, please. So let's begin with the Framework Convention on Tobacco Control, which is the world's first public health treaty. And until recently, it was the only world's public health treaty. We now have a pandemic preparedness treaty. And it came into force in 2005. We have 183 parties, countries, nations who are involved with treaty implementation. I'm from Canada. Canada was one of the early adopters. India was one of the early adopters. But we have most countries engaged. In fact, this treaty has one of the highest participation rates of any treaty. And the treaty is designed to address tobacco supply, demand, liability, research, and surveillance. And the articles of the treaty are based on the evidence for tobacco control. And in fact, over 20 of the articles are evidence-based, actionable tobacco control measures. So there is great alignment with the evidence. And the treaty is recognized as a model of success for global health. And I'm going to get into that in a little more detail. Next slide. So the treaty was over 20 years in the making, and it was a response to the rapid global spread of tobacco use in the last half of the 20th century. In particular, we know that tobacco use is the leading modifiable cause of chronic disease, and that extends to lung disease. 1/3 of adults, 1 in 3 adults age 15 plus, were using tobacco in 2000 at the turn of the century. So it was reaching peak levels, and it was an enormous public health concern. And the early projections when the treaty came into force was that 1 billion people presently alive that tobacco use would be responsible for 1 billion unnecessary deaths in the 21st century if it went unchecked, if tobacco use went unchecked. So that number in and of itself is an enormous call to action. Then there was a lack of coordinated international response prior to 2005. Some countries were engaged, but many weren't. And there was, especially in the global south, there was a need to engage countries in the global south to get more active on tobacco control. And we all know that the tobacco industry is the disease vector for this particular epidemic, and that the industry continues to aggressively market its products and to fight tobacco control measures, including the implementation of the treaty itself. Next slide. So there are a number of significant attributes of the treaty, and the treaty's early champions and drafters deserve full marks for developing a robust convention that remains fit for purpose and has withstood the test of time. And this is the genius of this treaty, including its comprehensive scope across all dimensions of tobacco control. The fact that it is built on evidence-based interventions. Not all treaties are. Tobacco control is harm reduction. We know the tobacco industry is trying to commandeer that narrative. Tobacco control in and of itself reduces consumption, and that is harm reduction. And it's designed, the treaty is future-proofed. It's designed to accommodate new challenges and to adapt to new evidence, and I'll touch on that. And of course, the treaty also protects against tobacco industry interference when it's properly implemented. And that is through Article 5.3 and the guidelines that are associated. Next slide, please. Now, Article 4.7 of the treaty mandates civil society engagement, which is a very important part of this treaty, and tobacco control. There are a number of civil society participants in today's webinar, and you know the vital role we all play in helping to advance tobacco control nationally and globally. And these roles include advocacy, monitoring and reporting, particularly on implementation of the treaty, serving as a watchdog nationally and globally, and supporting implementation and getting, rolling up our sleeves and actually helping to implement tobacco control measures when possible. The global efforts are coordinated by the Global Alliance on Tobacco Control, which is a coalition of over 200 tobacco control organizations around the world. And it helps to coordinate efforts, including on the treaty itself and the COP sessions, the Conference of the Party sessions that are held every 2 years, including the last one in Geneva last fall. And there was a tremendous amount of coordination and preparation by the Alliance, and there was palpable participation by civil society at that COP session and previous sessions. So very few treaties recognize the importance of civil society or give it special standing. And in fact, the Framework Convention does both. I was involved with the negotiations on the Plastics Treaty, and there is no such recognition for civil society in the working draft of the Plastics Treaty. So this is definitely a strong asset of the FCTC. Next slide. The treaty addresses tobacco industry interference, as mentioned, through Article 5.3, and guidelines have been developed to help countries establish policies to prevent industry interference, including direct lobbying, collaborating with governments, working through the industry's allies and government operatives, and buying favor through a variety of means. So the industry works in mysterious ways and uses many different levers to try to influence policy and to curb the impact of policy on tobacco use and tobacco sales. So 5.3 is there to provide a shield for governments from tobacco industry interference, and we encourage them to use that shield. We know that the tobacco industry is the poster child of corporate misbehavior. We've had millions upon millions of secret industry documents released online through lawsuits around the world that validate how this industry operates. And it's a rogue industry with predatory marketing strategies that is deliberately targeting people with social and health inequities, including our youth, and actively working to undermine tobacco control policy and public health globally. So the industry must be confronted, and the treaty allows for that. The treaty makes ongoing attempts to infiltrate the COP meetings, including the one we held last November. In fact, the industry managed to co-opt over 30 countries to read its scripts line by line at the COP sessions in Geneva. It's very disturbing, and did what they could to frustrate the process. Fortunately, the civil society groups were there as a counterbalance. And what you're looking at is the cover page for the guidelines for implementing 5.3, and we encourage all governments to fully implement these guidelines. And I'll be honest, Canada only recently developed its own guidelines. So countries are behind, and if we're going to make further progress, we definitely need to confront the industry. Next slide. The other genius of the treaty is the fact that it is future-proofed and remains fit for purpose, and it allows for the adoption of new measures that were not considered or were not viable when the treaty was initially drafted. And this is particularly important in the development of a tobacco endgame. When the treaty was initially drafted, an endgame was not seen as a realistic outcome. And the focus was on tobacco reduction. That was the focus back in 2005. However, times have changed and we've made tremendous progress. And now the concept and the theory of an end game is very much in play. Next slide. So, despite the progress, and I'll be giving you some numbers shortly, we've had a number of challenges with implementation over the past 20 years, including the pervasive industry interference, as noted. By the way, this poster was developed by Copilot AI, artificial intelligence, and represents what artificial intelligence thinks of tobacco industry misconduct. There's uneven enforcement of the treaty across countries, and there remains a divide between high and low income countries. And despite the progress that's been made in the global south, that gap is widening. So we have to address that, and quickly. There has been low implementation of Articles 9 and 10 of the treaty, which deal with product design and disclosure, which is a cornerstone of the marketing mix. And if we're going to reduce tobacco use, we definitely need to address product design and disclosure. Here in Canada, Canada was one of the first countries to ban flavors in tobacco products. But that's an example of how we can redesign the product to make it less appealing and less addictive. And we've got new nicotine products on the market that are confounding regulation and also confounding the implementation of the treaty. And we still have insufficient funding for tobacco control, and we need to increase sustainability. Next slide. So let's talk about the new nicotine products, including e-cigarettes and novel products, which have created a huge recreational nicotine market. The tobacco companies are largely behind this, and they have shifted from just selling tobacco to now becoming a nicotine and tobacco industry with numerous products that continue to evolve and appear on the marketplace. There's high youth uptake, which is no accident, and a significant dual use, poly use of tobacco and nicotine, which only serves to enhance the addiction. And the industry uses the harm reduction narrative to whitewash its image and to cause division between those of us working in public health and tobacco control. And we must refuse to take the industry's bait. We must work together to conquer tobacco use and nicotine addiction. And the industry, despite declining tobacco sales, continues to achieve record profits because of its efforts to shift to a nicotine market. So the industry is rapidly evolving and launching new products, as mentioned. These products are not harmless, and they share the same fundamental health hazard as tobacco use, the same fundamental health hazard, which is nicotine addiction. Youth and young adults are the primary targets and account for the majority of new users. And there are now several published systematic reviews revealing that youth who vape nicotine are 2 to 3 times more likely to start smoking. And if that was the only health risk from vaping, that would be more than enough to justify every measure we can take, reasonable measure to reduce nicotine vaping and nicotine use. Next slide. So COVID-19 caused the global disruptions to many, many sectors, and public health was not spared. And it wreaked havoc on public health and tobacco control, of course. Many governments and health authorities diverted precious staff and funds away from tobacco control to fight the epidemic, including Canada. And the delay of the 2025 target for tobacco control resulted largely from the treaty, and it corresponds with at least 50 million additional tobacco users and millions of resulting deaths because of these delays. So, of course, economic pressures and global instability also contribute to this disruption we're experiencing right now. I've already mentioned the increasing divide between high and low income countries, the global north and global south. Yes, the 2025 target that was initially set is going to be missed by several years. And again, that corresponds with at least 50 million more tobacco users. Next slide. However, despite these challenges, tobacco use continues to decline globally, and only 1 in 5 adults is now using tobacco products versus 1 in 3 at the turn of the century. That's a very significant reduction. As you can see, the rate of tobacco use among men is considerably higher, and this is especially true in pronounced in low-income countries. However, good progress has been made overall and in reducing tobacco use among females, which reduces health equities among women and girls. And this is very good news. Next slide.
Hello.
So, just going on with the progress and success, our global tobacco use is currently at a record low in this century. We have 118 fewer tobacco users since 2005, since the treaty came into force. And we will achieve the 2025 target by 2030, and we're very likely to achieve that target. So we're behind, but not far behind. And there is strong progress in numerous low and middle income countries, including India, despite resource constraints. And I might add that India is a global leader in tobacco reduction, and that is no small accomplishment. And many of you contributed. Thank you so much. And the achievement of our target and the reductions is no small feat. It's a global success story. Next slide. So the name of the game right now is treaty acceleration, especially because we had a slowdown resulting from the pandemic and other global disruptions. And there are various efforts to accelerate treaty implementation, and these efforts have been amplified since the pandemic. Many of you are familiar with the MPOWER policy package, and that's having an enormous impact, and efforts are being underway to accelerate implementation. We have an accelerator, an FCT accelerator that was launched in 2019, intuitively just before the pandemic, also known as the FCTC Global Strategy. And that is based upon high impact measures of the treaty and accelerating their implementation. There's global funding from Bloomberg and Gates and from high-income countries who are supporting efforts to accelerate treaty implementation globally, and particularly in low and middle-income countries. There's very strong civil society leadership. I'm always impressed by the work and activities and progress that's being made by civil society. And we've tremendous support from the Tobacco-Free Initiative at the WHO, which remains intact, completely intact, I might add, despite the disruptions at the World Health Organization in the last 2 years. And of course, the FCTC Secretariat, who oversees the implementation of the treaty directly and liaises with the 183 participating countries. And then we have a number of FCTC implementation hubs as well, which also deserve a shout out for their help in accelerating the treaty. Next slide. And monitoring and government accountability are also two cornerstones of the treaty under Articles 20 and 2022. And Ash worked with the Johns Hopkins School of Public Health and the Global Institute for Tobacco Control to develop the Tobacco Control Progress Hub, which is the world's first open access data visualization platform for the treaty and for public health, the public health treaties in general. Civil society, we've produced numerous civil society shadow reports. We've helped to from over 35 countries, 35 NGOs in 35 countries since 2023. The total population of those countries is 3.2 billion. So we like to say 3.2 billion people served because of the Progress Hub. And the FCTC hubs, as I've mentioned, on surveillance and Article 5.3 are also involved with monitoring and accountability. We have a Tobacco Industry Interference Index. The Global Center for Tobacco Control, for Good Governance and Tobacco Control oversees that. That's been a very important part of monitoring and accountability. And then we also have MPOWER reports published every 2 years, the Tobacco Atlas, Cigarette Tax Scorecard, it's published every year, the Sustainability Index that is overseen by our friends at a related NGO, and we have the Tobacco Laws Database and others. So there are a number of monitoring activities going on that increase the implementation of the treaty. Next slide. And yeah, this just highlights the Progress Hub. Over 300 indicators representing 15 years of reporting for 195 countries, 5 interactive dashboards that allow for users to sift and sort through large volumes of data, over 500,000 data points, and the hub produces visuals and data sets that are easily downloaded. They can be used by anyone, any stakeholder. It gives everyone access to treaty implementation. The media, governments, stakeholders, NGOs, and others. Next slide. Oh, this is interesting. The cover page is missing. Oh, there it is. Okay, great. So the Progress Hub was used to prepare a global shadow report, the first actually, on the implementation of the Framework Convention, the first independent shadow report. Let me rephrase that. And over 50 civil society organizations endorsed the report last year, which was submitted to the WHO and the FCTC Secretariat. So we now have global shadow reporting as well, independent, and that is led by civil society. And next slide. There's some key observations in the global shadow report, including the fact that the full implementation of the global strategy and the target has been delayed for 5 years. Global instability, including resulting from the pandemic, from climate change, from wars and political conflict, is also hampering progress. And these are distractions for governments. So that's where the main barrier lies, is it just distracts progress because it's distracting governments in general. And of course, we can never overlook tobacco industry interference, which is the #1 barrier to treaty implementation, according to the participating countries themselves. Despite all of these challenges, 150 countries have experienced declines in tobacco use since 2010, with 56 on track to meet the global target of a 30% relative reduction by 2025. We should start to see that data soon. So you'll want to check to see if your country has met that target. And as mentioned, the 2025 target for women is on track, and that's a huge success. However, we know that the spread between high and low income is widening, and we need to address that quickly. Next slide. So COP11 last November in Geneva was a major milestone for tobacco control that witnessed a shift from a global tobacco reduction effort toward a tobacco endgame and the end of the tobacco epidemic. So we're at a crossroads right now, and an important one. And our path to an endgame includes continued acceleration of the treaty and implementing the treaty, stronger protections against industry interference. More countries have to get their shields up against the industry so they are more better able to implement the treaty. We need to secure sustainable funding. Most countries can do that simply by increasing tobacco taxes. So that's a tool that's at everyone's disposal. And of course, we need to adopt the forward-looking measures and those that were proposed at COP11, which are aligned with a tobacco endgame. And just to conclude, I'm going to read the concluding paragraph from the editorial upon which this presentation is based, if you will bear with me. The global tobacco control community should be proud of the considerable progress in reducing tobacco use in the first quarter of the 21st century. However, there is no time to rest on laurels or allow the industry to regain ground. A tobacco endgame can be achieved if we continue to accelerate treaty implementation and build on success. There are at least 1 billion reasons why we need to make tobacco history in this century. Thank you again to all of our participants and to the Union, Sipher, Project ECHO, and the Indian Medical Association for sponsoring and hosting this presentation today. Thank you.
So thank you, Professor Hagen. And it was a wonderful presentation, actually. It was based on tobacco. It was published as an editorial in BMJTC, Tobacco Control, a model of success for global health in 21st century. So you gave us an overview, the WC Dublin Declaration you told about, then FCTC, you just briefed upon the FCTC also, and the implementation challenges you told in the tobacco control. And you also told about that Canada has already banned flavors. That is excellent. And you told about the new emerging nicotine tobacco products and why the global disruptions were there in COVID-19. And then it is a success story because there's a decreased prevalence of tobacco use worldwide. Progress and successes you told, and key drivers of treaty acceleration and how to monitor and accountability you're doing. Then you told about the global shadow report on SDG 3A targets and the path to endgame. So that is the thing now, the endgame of tobacco. That is, I think, very much a necessity these days. So I will request Dr. Tara Singh Baum, who is the vice chair in the tobacco control section, to just comment upon the presentation, please. Dr. Baum. Dr. Baum, are you with us? Professor Sonu Goyal?
Yes, sir.
Yeah.
Yes.
So you can comment upon the Professor Les
I think,
again.
yeah. So, hi, Les. It was really a wonderful presentation, as always. Great to hear you on this very important topic. So, just want to ask you one thing. I'm just it may be a not a very good question, but I was just thinking, listening to a presentation and just introspecting based on my initial thoughts that we have a lot of data when we talk about inputs uh, by various countries in terms of tobacco control, in terms of the tobacco control program, FCTC implementation, all those. And we have some data on the process which is being followed, um, and also some immediate outputs in terms of MPOWER. like how we are progressing in terms of empower. And we have data in terms of outcome or impact, that is reduction of tobacco use. So we have all the data here. But despite this, we are not able to relate that whether this particular process has led to this outcomes. Like tobacco control, is it really the outcome of the empower strategies, or is it something else beyond empower, or maybe socioeconomic development which is taking place in the country, or reduction of poverty, or various other sustainable development goals? So can you suggest like how we can relate the decrease in tobacco use to some of these process or immediate outcome indicators? I'm not sure whether you are able to comprehend my question, but uh, I can repeat in case it's not clear.
Well, it's a very good question, and one that you're probably better suited to answer, but I'll try. And when it comes to population impact, it is difficult to assign impact to a particular tobacco control measure or a set of measures. But we do know that you mentioned the MPOWER measures. We do know that all of those measures are evidence-based, and they do have an impact at a population level, particularly when they're implemented in tandem. And the same is true of numerous overlapping articles within the Tobacco Control Treaty. So we have to use epidemiology and population data to make those projections. But admittedly, they are projections, but they are based on solid implementation science. And I know in Canada, when we see significant tobacco control measures that are aligned with the evidence, we often see more times than not, we recognize reductions in tobacco use. Did I answer your question?
Yeah, I think right. So I think you have answered it quite nicely, and I was just wondering that if something can be done in this direction, because we have country-specific data as well, and we might model, because it is coming from your presentation, that the model of tobacco control. So we might model those factors which have worked in other countries and which have led to significant impact, and there are some factors which have not worked in other countries. So maybe I think that will be an interesting question on what particular empower strategy, or do we need to go beyond this empower? Right. I
Yeah,
rest my
agreed.
question.
And as you know, the impact of MPOWER has been widely published, and that serves as a base for modeling, in my perspective.
Right. Thank you, Lewis.
Thank you, Professor Goel. And any question? We had a question from Dr. Dilip Acharya. Dr. Acharya, can you just unmute yourself and just ask yourself? Dr. Acharya?
Yes, am I audible now?
Yeah, you are
Yes,
audible.
sir.
Yeah. First of all, I'd like to congratulate the ECO and the Sipher for organizing such a wonderful talk, which was really excellent. And the speaker covered a lot of different points connected to it. My just question was, though he was talking about that world over the female usage of tobacco is going down in India, but it looks like that, I mean, I may be wrong also, I stand to be corrected, open to correction, that females, especially college-going girls, the use of tobacco is increasing, especially the smoking is increasing is this thing. So I wanted to know the comments of the experts in this group. Yeah.
Yes, Professor Hagen, will you like to comment upon it?
I believe the question is regarding tobacco use in India. And I think you might be better suited to that, Dr. Gupta.
So there's the latest trend because of the social media also, and the females they want to just compete with the males. So maybe that is the reason. Then it's an open society now. Girls are working, and they're going out in hostels or the PGs that is paying us. So they may be using more because the latest National Family Health Survey that has shown that.
Right.
So, Dr. Charya, I think it is our duty to just wean them off.
Right. Right. You're very correct.
Yeah, yeah.
One more aspect, I would just say e-cigarettes and the thing, nicotine pouches. Some of the
That is a
countries they
separate thing.
permit and some don't
But
permit it.
NFHS was all about tobacco.
Yeah.
Yeah.
Okay. Thank you very much.
So we have Mr. Dr. Ramesh Gandhi also with us. Dr. Ramesh Gandhi, are you with us? Dr. Aruna. Dr. Aruna, then we have Susan. We have Susan and so nobody's there. Snehilata, she was a teacher in a St. Anne's school here in Chandigarh. So yeah, Aruna, yes, Aruna, you are muted actually.
Yeah, so thanks a lot for organizing such an global covered approaches in the tobacco control, sir.
Right, that you had in
Hello?
mind.
Hello?
Thank you.
Yes, you
Yes,
can just go.
We
ma'am,
can
you're
hear
Go
you.
audible.
ahead. Ramesh, can you just mute yourself, please?
You can continue.
Yeah. May I?
Yes, ma'am, you can.
Yeah, like
Ramesh, you can keep muted after this, Dr. Aruna. So you'll comment upon it. Yeah.
okay, sir. Thanks a
No
lot, Sipher and ECO, for organizing such a wonderful webinar on tobacco control. Sir, actually, I have one question here. So, like, what would be the status of the new emerging tobacco products which are seeping into the India as modified risk products and yet available?
Yeah, it is available actually online mostly, especially the nicotine pouches, oral nicotine pouches.
Regulatory
The
issues, like,
electronic cigarettes,
yeah,
they are available offline
yes,
also.
yes,
I mean, the physical at the points of sale maybe. We are actually weak in enforcement. India is weak in enforcement, though we have a PICA 2019. And
yes, sir.
against oral nicotine pouches also, there's Food Safety FSSAI Act also, Section 2.3.4. And then we have the drug control officers, they can take action against oral nicotine pouches. But surely we had a consultation in Delhi just day before, and
Okay,
I
sir.
think ICMR will come with the white paper on it, and maybe the government agrees to it, and it is totally banned. Yeah. Yes, Mr.
Sir,
Ramesh
what about
Gandhi.
the?
Yes,
Thanks a
yes.
lot, sir.
Okay, okay. Yes, Ramesh ji, Dr. Ramesh. Yes, yes. Be
Am I
quick.
audible?
Yes, yes, you are audible.
Yes, sir.
Okay. I'm traveling. Maybe the voice breaks. If it breaks, I've already put my question in text also. So, Dr. Rakesh, you can speak that question if my voice breaks. Thanks very much for correcting me. My question is that Empower policy has been in force for so many years, and impact has also been happening. But I have observed that social marketing has been a very effective field which has been emerging for mass behavioral changes, and it is
Yeah,
being
right.
utilized in other social programs and health programs. But I feel that it can be better utilized in Empower also for bringing the end game towards closer. So my question is that how can we think of bringing social marketing to tobacco control to make it happen, to make the end game happen faster?
Yeah. So thank you, Dr. Ramesh. And Professor Lessagan, is he with us?
I can take this question.
Yeah.
Well, and because it's a good question, and social marketing, when it's properly applied, can have a significant impact on tobacco use, and that's why it's one of the elements within MPOWER. I think one of the big missing opportunities or lost opportunities with social marketing is to publicly profile the behavior and marketing strategies of the tobacco industry. And in fact, California, for many years, has been aggressively undermining, or not undermining, aggressively profiling the behavior of the industry and its efforts to encourage to target youth, to target vulnerable populations, people with social and health inequities, and to with tremendous success. And that by exposing the industry, that helps justify stronger policies, including endgame policies. And it's very easy to do because of all the millions of documents online about the industry's behavior. And just using those documents, which would include marketing strategies from many, many countries around the world. Those should be profiled and highlighted and also letting people know that those strategies continue. This isn't past behavior. This is current behavior of this industry. And they continue to play and to use the same predatory marketing strategies that they have been using for decades.
So I must acknowledge the presence of Dr. Narendra, who is from NTCP Rajasthan. Mr. Avdesh Kumar, he's from Uttarakhand. Professor Sonu Goyal, you already heard. Dr. Jyoti Tiwari, Royal College of Nursing. And Dr. Danny Matthew, Dr. Indu Sunwari, Dr. Tara Singh Bam, Mr. Rajiv, Dr. Sherko, Dr. Rushi, she's a consultant with Haryana NTCP. Then Susan is also with us, Snail Lata, ma'am is there, Dr. Dalip Acharya is there, Dr. Ramesh Gandhi, and Dr. Aruna DS, and Dr. Bhatia is also with us. So anybody having a short question, they can just raise those questions. You can just unmute yourself and raise your question. You can ask. Yeah.
So there is a question by Ankur Kaushal and Mukta Kumari. Both of them are pretty much asking the same question. The question is, why is the government still giving permission to sell the tobacco-related products, especially the nicotine pouches and the e-cigarettes?
Yes. This question actually always crops up. So, Professor Les Hagen, will you answer this question?
Can you repeat that, please?
So the question is, why is the government still giving permission to sell the tobacco-related products, especially the e-nicotine, the e-cigarettes and the nicotine pouches?
Well, a number of countries have banned nicotine vaping products, and numerous countries have placed restrictions. In Canada, we initially banned nicotine products, and then we decided to legalize with restrictions because of the potential for these products to help people quit. But we have since discovered that impact is not as significant as the government was hoping. So we're in the process, like many countries right now, of walking this back and doing a better job of aligning our restrictions on vaping tobacco products on vaping products. We know from MPOWER and from the FCTC Global Strategy, we know the tobacco control measures and policies that have the biggest impact. We should be applying those to vaping and nicotine products. In other words, most countries require better alignment between their tobacco control laws and their vaping and nicotine control laws. And that better alignment is going to help to reduce and prevent nicotine use.
So Dr. Siddhi Hatiwala is there. Do you have any question?
So there's just one more question by Dr. Dilip. So your comments on the smoke-free generation. UK has just passed a law not to sell tobacco products to those born after 1st Jan 2009. Other countries in line?
Yeah,
That's a
even
very
government
good
of India
question. I'm
may do
sorry,
it.
Dr. Gupta.
Yes, actually, about the tobacco-free generation in UK, it is from 2009, I think. No?
Yeah,
January
first
2009.
From
first January
2009.
2009.
2009, yeah. So I think it is the right way to do it. So it is part of the tobacco endgame. If I'm not wrong, Professor Les,
Yes, it is
you
one
can
of
just
the acknowledged end game strategies, no question.
yeah. So any
And,
more
and we hope
queries?
we're hoping for wide adoption globally over the
Yeah.
next 10 or 20 years.
And we are hopeful for India also. Yeah. Dr. Preeti, do you have any more questions?
Sir, just one last question. Can you share your ideas about the tobacco endgame?
Yes, Professor Les.
So I'm going to encourage everyone to, and we'll provide a link to a report that came out of the COP11 on the proposed forward-looking measures for tobacco control, and there was numerous experts from around the world who were involved with the development of that report and looked at the evidence of a number of possible endgame measures. And instead of just reading them off and choosing favorites, I'll let people examine that list, and some are more relevant than others, and of course, some are more achievable than others in the short term.
And Professor Les, I think the tobacco endgame should include nicotine also, the nicotine products, isn't it?
In my opinion, there's no question. And what we know that youth who use nicotine are more likely to start using tobacco products. So that is a significant concern.
So, Dr. Preeti, there is a question from Rhythm also.
Yeah. So the question is, why do anti-tobacco campaigns often fail to resonate with adolescents despite the strong scientific evidence about the health risk?
Well, the short answer is that we need to communicate more than the health risks. It's not sufficient just to communicate health risks. There are young people and people in general have many motivations. And it's not just health, it can be financial, it can be industry manipulation, it can be social, it can be the impact on one's family. So we need to ensure that our messaging aligns with points of influence. And health information is only one point of influence.
Yeah. So I
Also,
think we just have 2 minutes with us. So any last query or a comment on his presentation?
I
Or
just put
otherwise,
a quote. I just put a quote in chat. One of my favorites from one of my favorite Indian leaders.
Okay.
I'll just read it out. Actually, I do agree with this quote as well. It is the health that is the real wealth, not pieces of silver or gold. And I think that the quote is by Gandhi.
Yes. So you can just proceed with the formal vote of thanks then.
Yes. So, sir, on behalf of Echo India, the union, and Sipher, and all our participants, I would extend a very sincere gratitude to Professor Les Hagen for delivering such an insightful and thought-provoking session. So your emphasis on civil society engagement, evidence-based policy making, and the vision of a tobacco endgame has inspired all of us to continue working towards a healthier tobacco-free future. The examples and the global perspectives you have shared have enriched our understanding and reinforced the importance of sustained commitment to tobacco control. I would also like to express our heartfelt thanks to Dr. Rakesh Gupta for expertly moderating today's session and facilitating an engaging discussion. A sincere appreciation to all our participants who have joined us this evening and contributed through their active participation and interest in advancing tobacco control efforts. With that, I would conclude today's webinar. Thank you, Professor Hagen, once again for being here. Thank you to all our participants for being here. Have a wonderful evening ahead. Thank you, everyone.
Yeah. Thanks a lot. Thank you, Professor. Thank you.
Thank you so much.
Thank you.
Thank you.